Hey guys, so I wanted to do a quick video on Thoracic Outlet Syndrome. So this is something that has been coming up in the news. I don't know if you guys follow, but there's an athlete, an NBA player that was recently diagnosed with Thoracic Outlet Syndrome, and everybody is really worried about it. So let me just explain what it is, how it can be very easily treated in most cases, and tell you a little bit more. So Thoracic Outlet Syndrome typically has three different types. So what it is when you have numbness and tingling down into the hands and fingertips, but also some weakness and of those muscle groups, and it presents kind of like a disc bulge of the neck would, only it's much more treatable and with a much better prognosis in most cases. So it can be what's called neurogenic, arterial, and yeah. So there's those types. So neurogenic means it's affecting the nerves. There's something pressing on nerves that are causing them to first overfire, which is going to be spasm and pain, and then next underfire, which is going to be the weakness and the numbness and tingling, and maybe even changes to temperature difference. So if you can't tell hot or cold, then that might be a sign that you have it too. Oh, arterial or venous, so blood supply, basically nervous or blood supply, are the two causes. So it can be from pressure on nerves or pressure on vessels. So one important thing is to do a test to see, are these vessels being the blood vessels being affected, or is it the nerves? And then you just have to find what is causing the impingement or the pressure and remove that or relax that area. And then you oftentimes need pretty consistent treatment, but it resolves on its own. Now, sometimes you will have an extra rib. Your C7, you're supposed to have your first rib start at T1, but if you have a C7 rib, an extra rib, that can cause some impingement like this. But most of the time, it's going to be compression and restriction in your cervical spine, causing the openings where blood vessels and nerves travel to become smaller and therefore putting pressure on them. Or three different muscles that are common in this. So your anterior and middle scalenes are in the front of your neck here, and those can cause a lot of impingement on the nerves. As the nerves exit the spine, they travel through those muscles and then down into the shoulders, and then to continue down the arms. So really, tightness of any of the shoulder muscles can start to cause these type of symptoms, but the biggest ones are your middle and anterior scalenes and also your pec muscles, especially your pec minor. So your pec muscles are obviously going to be on your chest, but they kind of run in this direction for the most part. And those can get really tight too. So a couple of things. One is if you are laying flat, on a bed or couch or floor or something, and you go to tuck your chin slightly and lift your head up. If you have trouble holding your head up like that, then you might have some tightness and problems in your scalene muscles. So there are some exercises you can do to strengthen that area of your neck, and that would help a lot. And then the pec muscles, a good way to kind of loosen those up is the best way is to get a massage or see a chiropractor who does the type of muscle work I do, which includes active release technique. But if you stretch your arm on this upward diagonal to open those pecs up, that can be really helpful too, for relieving tightness and therefore taking the pressure off of the blood vessels or nerves. So to wrap up, one good thing is that this is a very treatable condition in most cases, although it feels very scary when you're losing function and feeling weak and having numbness and tingling, and it's almost like your hands and arms can't do what they've been doing for years. But on the other hand, if you just have some regular care, take a chance to decompress the neck, to reduce any restrictions, get adjusted regularly, and keep those muscles nice and loose with a few home exercises and stretches, you should be well on your way to feeling better. If you have any questions, please feel free to message us. Be happy to talk to you about your thoracic outlet syndrome, whether you have it, what type you might have, and how to get you started feeling much better. And as always, feel free to drop a comment, say hi, and just let us know that you're watching. Have a great day.